name's Phil Sauve. I'm a consultant trauma and orthopaedic surgeon based in Portsmouth in the UK, and I'd like to discuss interpositional arthroplasty and the treatment of thumb-based arthritis. I'll discuss why we want to use these implants when we have a perfectly acceptable treatment option in the form of a trapeziectomy. I'll look at what we've used historically, and I'll look at some more modern implants and their outcomes too. The aim is to deliver a treatment that can provide our patients with pain relief, range of movement and grip strength to allow them to maximise their function following surgery. The question is, will these new implants provide all three of these aims? Early outcomes of one of the earliest interpositional arthroplasties, the stem silicone trapezium replacement, were very positive. Swanson's series of patients all had very good functional improvements following surgery. However, multiple later studies demonstrated failure incidences as high as 20 to 66%, and these failures were due to implant fracture, subluxation, and silicone synovitis. Nilsson published a series of patients treated with the Artelon Spacer. This was a degradable synthetic biomaterial designed to resurface the distal part of the trapezium, preventing bony impingement and to augment the thumb CMC joints. Again, patients in this first series were pain-free at 3 years following surgery and had a better grip than those in the comparable trapeziectomy group. However, other series and reports describe pain, swelling, and erythema in the thumb base of many patients who had had this prosthesis. Histological analysis showed large numbers of foreign body type multinucleated giant cells within the soft tissues and bone closely associated with the implant, however. And when reviewing multiple publications on the outcome of this prosthesis, the revision rate was approximately 17% on average. There are various polycarbon implants available for the thumb base too. These implants can be used following trapeziectomy surgery or following minimum trapezium resection. Stabilization of the PI2 implant was a concern with a high early dislocation rate, leading to a revision rate of 33%. Hydrodisc offered more stability, and Smaraglia reported just last year excellent 8-year results with a 7% revision rate. I've been an investigator for the grip studies evaluating the use of the Cartiva CMC implant for the last 5 years. This implant is made from polyvinyl alcohol. It's a molded cylindrical implant which sits in the base of the first metacarpal and is proud by 2 to 3 millimeters. And a little like the rubber on the end of a pencil, it's press fit only and is not bonded onto the bone. The implant has a high water content, and like cartilage, when load is applied, fluid migrates through it. It's previously been used in the foot for the treatment of hallux rigidus, and it's been used in over 15,000 cases with an 85% survival rate at 5 years. We enrolled 50 patients with Eaton Littler stage 2 or 3 onto this multi-center prospective phase 2 study at sites in both the UK and Canada. We saw major improvements in pain and quick dash at 12 months, with continuing improvements in the second 12 months. Not only did we identify further reduction in pain, but we saw continuing functional improvement too. Cartiva demonstrates a greater improvement in pain reduction when compared to trapeziectomy data from the literature. And Cartiva also demonstrates a 56% and 60% improvement in key pinch and tip pinch strength respectively, which is significantly more than that achieved following trapeziectomy. However, we had failures too. 8 implants were revised because of pain, and this was due to subsidence or joint laxity. And so the early results of this novel synthetic cartilage implant are not dissimilar to those of historic implants that I've discussed earlier. We'll have to look closely to see how this new implant fares over the coming years. At the start of this presentation, I asked if these new implants were the answer. Well, I guess that we still don't know yet. Thank you very much.